Good evening and welcome to City News. 0 deaths and the lowest case count since last September. That's where our province stands today in the fight against COVID-19. As we inch closer to a much wider reopening, calls are growing louder to loosen restrictions that remain on hospitals and their visitor policies.
So right now your husband's in the emergency department and you're not allowed to be with him?
No. As far as we know, no. He's sitting there on his own. Nobody's given him any direction. At some point, I need to get in because he has heart medication, etc., that he needs.
Suzanne is now patiently waiting on the status of her husband, who recently suffered a ruptured hernia. The couple lives north of the city, but hospitals throughout the GTA have similar policies on visitors. Last week, Suzanne tells me she was not allowed to escort her 93-year-old mother to an appointment at Sunnybrook Hospital.
There's 5 different stations to check in. I gave them my mother's name. They checked that in, and I proceeded to try and help walk with her, and they told me I wasn't allowed in. And it's just very emotional for seniors not to have that support.
In a statement, Sunnybrook says currently the hospital is limiting companions for outpatients, including our family health team. The exception is for those patients with significant needs. It goes on to say that this is keeping with guidance from the Toronto Region COVID-19 Hospital Operations Table, which oversees visiting policies in Toronto hospitals.
As the COVID situation has improved, my view is that hospitals need to lead and signal to the public what we can actually do safely.
Right now, policies vary across the GTA. Trillium Health Partners, for example, is typically not allowing visitors in the emergency room and has a time limit of 2 hours for designated caregivers visiting long-term patients. Dr. Michael Warner believes it's time to normalize the experience, and right now he says the benefits far outweigh the risk.
It can be as simple as being able to take notes during a clinic visit while you're getting a cancer diagnosis, or asking questions on your behalf if we don't speak the language that the patient speaks. It also really benefits the healthcare workers because we can learn about the patient through the eyes of someone who loves them.
In Suzanne's case, her husband has been in hospital all day and is now awaiting the results of a CAT scan alone.
Now your husband, do you think he wishes you were at his side right now?
Well, I'm sure he doesn't want to sit there alone. And he's very nervous about, what's going to come. So, yeah, of course you would always like company when you're in a stressful environment like that.
And in my view, now that we're in the vaccine era, there's so little COVID activity in the community, we can open up hospitals to all visitors unless those visitors are supposed to self-isolate because they have COVID or exposed to COVID. I think it's that straightforward.
In some ways, nursing homes right now have fewer restrictions than many hospitals. We did reach out to the Ministry of Health about visitation policies. We did not hear back by deadline.